You're dispatched to a 54-year-old male with vomiting blood. When you arrive, you find him sitting forward on the couch. There is bright red blood in a trash can beside him. His wife tells you he has a history of liver cirrhosis and drinks every day. His skin is pale, he looks anxious, his pulse is rapid. So what's happening? And clear. So ideally we make extra space This patient may be experiencing esophageal varices. So what are esophageal varices? Esophageal varices are enlarged, fragile veins in the lower esophagus. They develop because of the portal hypertension, increased pressure in the portal venous system. The most common cause, cirrhosis of the liver. Cirrhosis causes scarring. Scar tissue blocks normal blood flow through the liver. Pressure builds in the portal vein. When that pressure rises, blood is forced into smaller veins, including the veins in the esophagus. Those veins stretch, they enlarge, and they can rupture. So why is this so dangerous? When varices rupture, the patient can lose massive amounts of blood very quickly. This is life-threatening hemorrhage. Patients may present with vomiting bright red blood, coffee ground emesis, black tarry stools, weakness or dizziness, pale, cool, clammy skin. In severe cases, hypotension, tachycardia, and altered mental status. These patients often already have liver disease, which means poor clotting ability, increased bleeding risk, and high mortality. Look for clues on scene. Alcohol containers, medication bottles, history of hepatitis. Signs of chronic liver disease include jaundice, ascites, spider angiomas, and abdominal swelling. Ask focused questions. Do you have liver disease? Have you vomited blood before? How much blood have you lost? Are you feeling lightheaded? Your assessment priorities include airway, breathing, and circulation. These patients are at high risk for airway compromise. If actively vomiting blood, have suction ready. Position upright if tolerated to reduce aspiration risk. Monitor oxygen saturation. Administer high-flow oxygen as needed. Check vital signs frequently. Watch closely for signs of shock. This is a high acuity patient. Request ALS immediately. Do not wait for deterioration. These patients may require advanced airway management, cardiac monitoring, fluid resuscitation, and blood product support at the hospital. Early ALS involvement improves outcomes. There is no definitive hospital fix for varices. This patient needs rapid transport to a facility capable of blood transfusion, endoscopy, and surgical or interventional treatment. Do not delay transport on scene. Notify the receiving facility early. This patient can deteriorate quickly. Be alert for hypovolemic shock, altered mental status, cardiac arrest, and aspiration. Stay ahead of the problem. Anticipate decline. In closing, esophageal varices are dilated veins caused by portal hypertension, most commonly from cirrhosis. When they rupture, they cause massive upper GI bleeding. Your priorities: recognize the signs, protect the airway, support breathing, request ALS early, and rapid transport. Early recognition and rapid escalation saves lives.